Hello, this is Isabel Galliano, and I am the co-founder of The Cancer Coach. Our mission is to support cancer patients and those affected by cancer throughout their healing journey. And today in this talk, I want to talk about breast cancers in young women. Indeed, breast cancer is on the rise. Actually, breast cancer incidence has never been that high as it is now, and it's still going up. The reality is that the incidence is higher in every age group, also in young women. And today I particularly wanted to talk about young women and breast cancer. And I'm very honored to have today with me Dr. Tilba Tan, and she is the chair and the preoperative and young women's breast cancer program at National Cancer Singapore. I hope I said that right.
Thank you.
Thank you very much to being with us today. And so you see a lot of young women, and you see every day, the impact that breast cancer has on young women and the particularities it has and the challenges it has on young women. So if you don't mind, Dr. Tan, me asking you, the first question is, do we have any kind of understanding why breast cancer is on the rise?
I don't think we know. I think breast cancer, if you look at the incidence of breast cancer in Singapore, it's a slope that's just going, a pretty steep slope going up. Unlike, say, some other cancers like lung cancer, where, there's been a lot of education about surrounding smoking, when we see the incidence of smoking come down, so we're also seeing the rates of lung cancer coming down in some situations. Unfortunately, breast cancer is on the rise, and some of the possible explanation may include, for example, an increase in uptake of screening in an older age group. There's some purported change in lifestyles, for example, adopting a more Western lifestyle, for example, an increase in alcohol intake, or just in general, people being more sedentary. People, because they're more sedentary, there's a higher rates of obesity, a higher rates of, heavier people. The other thing also that we've come to understand is the use of hormone replacement therapy, including oral contraceptive pills, has also been associated with a rise in breast cancer. Some of the other risks involve not having children or having children later in life. That's also been associated with an increased risk in breast cancer. So particularly to a young woman, I think some of the risk factors that we should consider are things like alcohol intake, a family history. If there is any genetic mutations that are associated with a hereditary predisposition to breast cancer, such as the BRCA mutation, that can also increase your risk for breast cancer. And of course, there are some ladies who have had radiation therapy to the chest area. For example, if they've previously been treated for another cancer, like lymphoma, that can also increase your risk for breast cancer. So having all these risk factors should alert us to that risk and therefore be more mindful. But quite honestly and very frankly, many of my young patients whom I see in my practice do not have these risk factors. And it just occurs out of the blue.
Yeah, and that is actually something that's why it's also so important to talk about it, because many young women would never think that it could happen to them. And if they feel something, first of all, the awareness is not necessarily there, and they don't necessarily check their breasts on a regular basis because they think they are not concerned by it. And I also see in my daily work that many women would tell me, oh, I did feel a lump, but I really didn't take it seriously. I just thought it would go away, and then suddenly it became bigger and bigger. And we know, of course, that early detection makes such a big difference, right?
Yeah. Yeah. I mean, I think we're at the age group where, we're young, we're at the prime of our lives. These things sometimes doesn't, not everybody, although breast cancer is very common, it's relatively common. Not everybody necessarily has any, will have an interaction with somebody who had breast cancer. And when you're young, you just don't think about it, right? You think you're invincible, only older people get sick. I think that sometimes that's the mindset. And young women do have changes in their breasts that are associated with, normal menstrual cycles. So it's not unusual for young women to maybe perhaps, at certain times of the month have more lumpy breasts than usual. So sometimes these symptoms, may go unnoticed. And similarly, when a young person presents to a doctor, not that a physician doesn't take them seriously, but again, statistically speaking, you're more likely to be diagnosed with breast cancer when you're of the age between 50 to 60 years old, as opposed to someone who's in the ages between 20 to 40 years old, right? Not that I'm saying it doesn't happen. I'm saying that it's statistically speaking less likely to be diagnosed at such a young age. So some of these issues do contribute sometimes to later diagnosis in younger women.
And also younger women have denser breast tissue, so it's also
absolutely
much more to detect and to feel it. And even I think that's also one of the reasons why even mammograms don't pick it up so easily.
Absolutely.
The density of the breast.
And also when we're younger, the national guidelines for screening mammograms start really at the age of 40. Okay. At the age of 40, well, at least in Singapore, the recommendations are for yearly mammograms from the age of 40, and then from the age of 50, that drops to every 2 years. So from the age under 40, there isn't a screening test. And the reason why there isn't a screening test that's good is for the reasons that you have pointed out, that the breast tissue is actually really dense. It's very difficult to screen at a young age. Hence the importance of breast self-examination. And the recommendations here are to do breast self-examination every month. But what I would say is it's essentially being aware of your own body, knowing what is normal. So when there is something abnormal, you pick it up and you seek attention immediately.
Exactly. And that's something that we really always try to put a lot of awareness in it. Is the more you know your body, and there you need to really touch, it's important this breast awareness and to talk about it and not to be shy about it, to know how your breast feel. The better
Absolutely.
you feels, the easier it will be for you to detect some kind of abnormality. And I understand that many breast cancers in young women are detected by a woman having touched a lump or seen something abnormal.
That's correct. Yeah. Many breast cancers occurring in young women occur or are picked up because they are symptomatic at the time of presentation. So they go to see their doctor because maybe they've noticed some skin dimpling, some skin changes, a lump, or they felt a lump, and that lump is growing. The way breast cancers behave in younger women is that they tend to be a little bit more aggressive. So they tend to grow. And therefore, this usually alerts a young woman to go and seek attention.
Yes. And I always remember my experience with breast cancer. So I just came back from my honeymoon, actually, and I was putting cream because I had a little bit of sunburn, and I felt very clearly a lump. And I also know that it was not there, not that long ago, because I would put sunscreen. So it was really quite fast, and which alerted me. But as you said before, when I called my GP and I said, I can feel a lump in my breast, the first reaction was, come on, you are 32 years old, don't worry, this is nothing. And I insisted, on having it checked, and it turned out to be indeed cancer. And I think these are really important reminders for women that, of course, most lumps that you will find will not be cancerous, but still don't take the risk and go and get it checked.
Absolutely.
So I just wanted to quickly go back to some of the risk factors that we mentioned, but what are some preventative measures in terms of lifestyle that women can look at to reduce their risk of breast cancer? Of course, we know there is no guarantee, but we also know that lifestyle does have a big impact on your cancer risk.
Okay, well, I think the two biggest things that is important is if you're someone who consumes alcohol, maybe decrease your alcohol intake. We do know that has a very strong association with breast cancer. The other thing is to try and maintain an ideal body weight. Okay, actually it's three things. Maintain an ideal body weight, ideally through exercise. So we know that a moderate amount of activity, about 150 minutes a week, can be helpful in reducing the risk of breast cancer as well. Okay, so reduce alcohol, exercise, and maintain an ideal body weight. And these are the three biggest things that would be the most helpful. I think everything else, especially supplementation, dietary considerations, haven't really been founded to be either associated with a risk or associated with a decrease in risk of breast cancer.
So in terms of alcohol, I think that what research has said is that it really, the time that you have been consuming alcohol and the amount of alcohol consumed does increase your risk cancer. And generally, guidelines are no more than 1 glass of alcohol for a woman, and try to also drink water when you drink alcohol, so to dilute a little bit the effects. And then when you talk about body weight, it's important because the body fat increases your risk because it produces more estrogen, but also you are at higher risk of diabetes, which again is an additional risk factor for breast cancer. And I think that, you mentioned exercise, and I've lately been done a little bit more research around exercise and breast cancer, and I found it very astonishing and actually very, very positive, the effect that exercise has, particularly also on reducing the risk of a recurrence of a breast cancer. So
yes.
Can you maybe talk a little bit about that, also in terms of reducing the risk of a recurrence for young women?
Yeah, I know. I think, partly also is to just be very mindful, and just what you want is a healthy and a balanced lifestyle. The other thing also that exercise can do, which sometimes goes unnoticed, is that it helps to mitigate some side effects of cancer treatment. And if it can mitigate side effects of cancer treatment, you're more likely to see compliance with the treatment. A lady who can stick to the therapy and take it daily as prescribed by the doctor, because some of them, the treatments that we give for breast cancer, for example, the hormonal therapy, can be associated with side effects like fatigue, lethargy, arthralgia, which is basically aches and pains of your joints. And it's not infrequently in my practice do I have a woman come in and say, I feel the worst in the morning when I get out of bed. I get a lot of joint aches and pains, but it's almost like she gets very addicted to exercise because she feels good after the exercise. So much so that the day that the exercise doesn't happen, they just feel wretched. And I think that all these sort of helping to reduce the side effects, helping your general wellness and well-being, really does help to improve one's state of health, and therefore, it makes sense that it would reduce the risk of breast cancer, to reduce the breast cancer recurrence.
Yes, and that's something that we have definitely also noticed, at the Cancer Coach. We have a lot of young women actually with breast cancer. And if I get them, to do regular exercise, they feel so much better, not only physically, but also emotionally and mentally, because it gives you these feel-good hormones. It gives you a sense of, oh, I'm still capable of doing this, going outside. So there are so many positive aspects on doing exercise that should not be overlooked. So I always say, whatever you can do, just do it. It's not about all or nothing, but every little bit you can do. Even if you can just go for a walk for 10 minutes or 15 minutes, that's already a tick, and you should do as much as possible.
Yeah.
Good. So and then if as you see every day in your practice as a medical oncologist and specialize in young women, there are particularly challenging situations for young women because they are faced with different challenges than maybe older women. Can we maybe talk a little bit about that?
Yeah, sure. So in a young woman, often these are women who are daughters, they are mothers, they're wives, they perhaps might be at the point of their career where they're taking on a bigger role, they're up for promotion, or maybe they're just starting out in their career. There's a lot of things in that particular life stage that's going on at the same time, much less a diagnosis like breast cancer. A lot of our treatments can also be fairly intense and fairly involved. And so, one of the challenges is really trying to make sense out of, I find with my patients, trying to make sense out of the diagnosis. Why now? Why me? And I get a lot of that whys. The other thing also, two other main things to think about in young women is one, the impact of treatment on fertility. So, not just because the treatment may potentially affect ovarian function. So, a woman may potentially go into menopause early, but it also can affect a woman's ability to bear children in future. And that recognizing that the treatment can have that impact, we often advise our women to seek consult from a fertility expert to consider assisted reproduction, for example. And in itself, that topic in itself is quite big, quite a lot to take in. It's a little bit much, and often some of these decisions need to be made quite quickly. So what I feel quite strongly about is to keep talking about this and sort of generate awareness in a way so that you kind of have some kind of baseline understanding. And so people are talking about it. Um, and if, unfortunately, one was to be diagnosed with breast cancer, hopefully by having all these conversations early on, it can help you understand and overcome some of these hurdles and these challenges. The other thing about cancer treatment is the time that you spend on cancer treatment often is a time that it's not permissible to fall pregnant.
Mhm.
And we know that currently, I think, especially in the news, you see that um, the our birth rates are falling. Our marriage rates are falling. Ladies are leaving it late to start their family. So often by the time a woman comes to thinking of, after she's gotten married, comes to thinking of having a family, then being diagnosed, having this diagnosis, that's when you're thinking, okay, but I was just talking to my husband yesterday about starting a family. What am I going to do? So that can be a little bit challenging. The second big thing is actually genetic testing and the concept of hereditary diseases. We're more likely to find a genetic, a mutation in the genes that predisposes to breast cancer in a young woman as we would in somebody who's older. So having a very strong strong family history for cancers like breast cancer and ovarian cancer should alert somebody to thinking, ooh, is this something that happened because of a mutation in a gene?
So would you usually recommend young women to do a genetic testing, even if there is no family history at all?
Yeah, I do, because it's also very varied. So
Mhm.
we sometimes have ladies who have a very small family. So you may not have a big enough family to have the family history, and some women are not so aware of their extended family history. So just having a family history, not having a family history alone, may not necessarily mean that you don't have a genetic mutation. We do know that many women are missed, and so in in general, if I face any young woman, I would recommend a conversation about genetic testing.
And I think that's very important to mention that. And just yesterday, I had a client who said, I was diagnosed with breast cancer. Absolutely no cancer history in my family. I don't see why I should take a genetic test. And I think it's important to educate women that this will actually impact the treatment plan. So depending on if you have a genetic mutation or not, your doctor might, consider different options of treatment.
Yeah, I mean, we have advanced so much now that we have all these targeted therapies that have been designed to target specific genetic mutation. And so increasingly, having this knowledge does make a big difference to a woman's treatment plan. Additionally, once you know that you have a mutation, it alerts the doctor to which types of cancers that are more prevalent or more commonly diagnosed when and associated with these mutations. So we can be more vigilant. We can screen closely. We could watch closely the areas that potentially have a higher risk of turning cancerous. The other thing is you could proactively think about prophylactic
Mhm.
surgery. So some women who are diagnosed or who have a BRCA gene may electively decide to remove their breasts or remove their ovaries ahead of time before they turn cancerous.
Yes, and I think this is very powerful information to have, and that's why we have this kind of talks, to shed the awareness about the importance of doing this test. And another thing that I think is very important to remind women is that there is not one breast cancer, that there are so many different breast cancer, and very often I see, at the Cancer Coach, women who are very, very confused, especially young women who say, but you know. I knew a person and she only had pills to take. Why do I have to take intravenous, or why do I have to do more surgery? So I think this understanding that there are so many different types of cancer, and that depending on exactly the type you have, your treatment plan can be completely different.
Yeah, I think as a community, as an oncology community, we are certainly getting smarter at treating breast cancer. Not all breast cancers are made the same. Some breast cancers do not require chemotherapy. Some breast cancers do, and will respond very well to chemotherapy. Some breast cancer respond to hormonal therapy. Some breast cancers simply do not. And so we take a very personalized approach. We look at the stage, we look at the way it behaves, we look at the biology of the tumor, we look at certain tumor markers expressed in the tumor, and we then make that decision and sort of formulate a treatment plan that is customized to that woman. And I would caution against, taking the experience from another person, because everybody respond very differently to chemotherapy and to treatment, and everybody would have different treatment plans as well. We're right now looking. I mean, we've advanced to the point where there's some women we think we can spare chemotherapy. There's some women we think they're treated very well with hormonal therapy alone or escalating the hormonal therapy. There's certain types of breast cancers, like the HER2 positive breast cancers, that are treated and have very good prognosis or outcomes by after treating with a targeted therapy. And there are some women who may have treatment or systemic treatment prior to having their surgery, just so that we can see how well they respond to the treatment and then tailor their treatment after their surgery. So we're getting, I like to think, smarter at treating breast cancers.
And I think that's really the way to go. I mean, the more personalized, the more individualized the treatment are going to go, and that's the direction it's going to be. The more efficient it's going to be for women. But on the other hand, for women, it's so much information to have to deal with, and that's so overwhelming. And that's part of what we do at the Cancer Coach. Is we see women who are completely overwhelmed with the amount of information because they had no knowledge about cancer at all. And then suddenly they need to be an expert in breast cancer, in HER2 neu positive, or triple negative, all this staging, grading, hormone therapy, and it's really a lot kind of thrown at them, and it's very, very overwhelming. So it is so important to have that additional support and to be able to ask questions. And I always say, it's so important that you have clarity about your situation, and also a clear understanding about the treatment that is suggested to you. So having the time to ask the questions. And I guess that's something that you encounter also at every day with your young women.
I do. It's so tough, and I think what I want to say is you're not alone. It's a very common. It's a very common illness. There are many young women who are being diagnosed with breast cancer, and I think just because of the nature of my practice, I've just been seeing more and more of them, and it's difficult. It's difficult because I have to give a lot of information. So often I tell my ladies, don't feel like you need to take it all in at one go. Take it one step at a time, and we'll just break it down into bite sizes. Have small goals. We get to that small goal, and then we aim for the next, and we aim for the next, and ultimately we'll get you through the treatment. But there is light at the end of the tunnel, and many women get there, and many women complete their treatment successfully. It's tough going through it. But there is also it's also important to have a social support structure that's going to help you through that, right? And we also at the National Cancer Center, part of the process of having this young women's program is to ensure that we uh, we provide these women with the supportive care needs that they need to get them through their treatment.
And I think that what I see a lot with young women is that there is very often a deep feeling of isolation. So you see at, your friends, their life just is normal going forward, and you suddenly are put into that life. And there is also often a feeling of guilt. Did I do something wrong? I have prevented it. Fear, of course, is another emotion that is very, very present. And I also feel that there is a lot of fear around their professional life, because they are afraid, to if they will be able to continue their career, how will it be perceived in the work life? And there is still, and I would like to hear what you think about it. There is still this kind of stigma around cancer, that many people don't like to talk about it. Many people don't want to admit that they are going through it, and they kind of want to hide away. And this doesn't make it easier on a social level, on a professional level. And we know, and statistics show it, that people who feel supported do much better. And so is that also what you encounter with young women?
Yes, I mean, I think everybody is different. Some women take it on head on, and some women prefer to go walk this journey privately, And I think there is no right or wrong way. And I think it's just equipping yourself to be able to cope with it and to manage it. And to also know that you are not alone. And I think a big part of what you're doing now, what we're doing now, is to keep having conversations about it. And by having conversations about it, we can break down the stigma. Okay. And I like to think of cancer not as a diagnosis that's associated with, death or end of life, a terminal disease. It is fast becoming a chronic disease that, it's treatable, and in many situations it's curable. We have many ladies who are primarily diagnosed at early stages who have very good outcomes. In some situations we see more than 90% of women cured of their breast cancer. So life has to go on. So a lot of our work surrounding counseling about fertility and so on and so forth is because we want to ensure that you can continue to have a life beyond your cancer, because we know that potentially you could do very well.
Yes, and I think that's also a very important message that we want to give. It's about awareness, but it's also about hope. It's about giving hope to women who unfortunately have been diagnosed with a breast cancer, who are going through it, and let them know that yes, incidence rates are higher than ever, but also the treatments are better than ever, and
Yes.
outcomes are better than ever. And I think it's very, very important to remind that that many women will live very, very long lives and will get back to their normal life after breast cancer diagnosis. And I'm a very good example for that. So I was diagnosed when I was 32. I'm 47 now. And I always want to share my story, to tell them, it's very hard to go to treatment, and I can't make it, beautiful in any way. It's tough, but it's a period in your life that you have to go through. And at the end of that period, there is light again, and you can slowly go back to your life. And that's very important to remember, that treatments are getting better and better, and outcomes are getting better and better.
Absolutely. Very well said.
I will also ask our viewers if they have any questions for me or for Dr. Tan. Please go ahead. I have had one question earlier asking about the risk of breast cancer related to smoking.
Yeah, so actually smoking also does increase the risk of breast cancer as well. And so I think that it is a habit that if you could cut down or stop entirely, it would be great. It's also a risk to a lot of other types of cancer, not just limited to breast cancer, such as lung cancer and skin cancers, for example.
So that's another important point to remember. Maybe often people link it only to lung cancer, but actually smoking puts you at higher risk of many types of cancer, including breast cancer. And I also had read a study about that specifically combining smoking and alcohol makes it even more lethal and puts you even at higher risk. So these are again factors to try to eliminate. And then another question I have is around oral contraceptive. Does it increase your risk to take oral contraceptive? How should women, go along with that? What should they do in terms of contraception to reduce their risk of breast cancer?
Yeah, so it has so these hormones, because lots of oral contraceptive pills do have estrogen within them, so it can increase your risk of breast cancers as well. I mean, there are other alternative forms of contraception, for example, barrier methods, the coil, etc. But I understand at your life stage sometimes these methods of contraceptions are important. Not saying that you absolutely cannot have the contraception. It's just being aware that it has been linked to a higher risk of breast cancer. So perhaps one of the things you could do to try and mitigate this risk is reduce your alcohol intake, stop smoking, exercise, keep an ideal body weight. So it's just not looking at that one specific factor, but sort of your lifestyle in general.
Yes, and again, it's all about awareness. And if you know, for example, that there has been a family history of breast cancer, or that you have a genetic predisposition, that's where you need to be even more careful.
Mm-hmm. Absolutely.
I have another question here, if you don't mind. So there's a lady saying that she just recently read in a medical journal that mammogram in younger women with breast cancer might reduce or might be easier to detect cancer if they go for mammogram before 40. And what is your thought about that?
Yeah, so I think particularly in Asia, we tend to have denser breasts. And along the lines of what we discussed earlier, sometimes when you have very dense breast, it means your breast tissue is very thick. It may hide breast lumps, breast tumors behind it. And sometimes if it does, and you do a mammogram, it may not necessarily pick up an early breast cancer. Okay, so I think that's one of the risks that are associated with doing mammograms. And it does generate a lot of anxiety as well after you've done it, because you're worried about results. And there are things that we have to think about, like sometimes we mention words like false positive. That means we may pick up something incidentally and it may turn out to be nothing at all. And false negative, where you have that false reassurance when you have a negative mammogram, but perhaps it's negative because it just didn't pick up a tumor because of the dense breast tissue. So I think these are conversations that needs to be had with your physician or your doctor who's ordering the test. In young women who do have a predisposition for breast cancer, such as women who have a genetic mutation, sometimes we do recommend for an MRI scan of the breast to pick up these tumors, because we know that the risk is so much higher. But for all intents and purposes, for the general population, the recommendations are for breast self-examination and then a mammogram from the age of 40 onwards.
And when we talk about self-breast examination, I think it's also important to give a little bit more details and to say that ideally women should examine their breast every month. So that's something else that I noticed, that women would do it like once or twice a year. But specifically in young women, because we know that cancer grows faster, it's important to check it actually every month and to make sure that you really don't forget to do that.
Yeah, so one of the other thing to highlight about breast cancer in young women is these cancers, as I mentioned before, tend to be a little bit more aggressive. So when they pop up quite quickly. So if you do, for example, a mammogram that every year, having a negative mammogram now doesn't mean in 6 months' time a lump couldn't pop up. Okay, so being mindful of what is normal means that when a lump does pop up, you notice it, just as how you did, right? You notice it and you go and seek attention. So in a similar way, when we talk about monthly breast examination, it doesn't have to be so specific as that. I mean, every time you're in the shower, or you stepped out of the shower, you could have a look in the mirror, look at yourself, and see if there's any new changes, if your skin might look a little bit redder or dimpling, or your nipples might be inverting, or for example, if you have any nipple discharge. These are things that should highlight to you, well, something is not quite right. um, and when you're in the shower, as you're soaping yourself, and this is quite common actually, some women will say they picked up the lump because they were soaping themselves and they thought, oh, this felt a little bit funny, and then they went to go and see their doctor. So examining yourself every month is just purely to just generate that awareness of what is normal, so that you are able to pick up what is not normal.
And I think it's also important that you highlighted that it's not only a lump that needs to be looked at. So it's also some irregularities in the skin, in the texture of your breast, the color, so when it's red or when there is a discharge. So there are many things to look at, not only looking for a lump.
Yes, that's right.
So you mentioned that typically for young women, cancer tends to be more aggressive. Does that mean that typically cancer treatments also need to be more aggressive?
So some of the more aggressive subtypes of breast cancer are treated quite well and successfully with the addition of chemotherapy. How aggressive a chemotherapy regime is going to be really depends on the stage of the cancer, how big the tumor is, has it affected the lymph nodes, so on and so forth. Not all treatment plans necessarily require very aggressive chemotherapy. Some of the targeted therapies that we use to treat certain types of aggressive breast cancers, like the HER2 positive breast cancers, actually don't have too much side effects. There are some side effects that have to be um, considered and thought about, but that can be monitored by your physician, and they're not necessarily difficult to. These treatments are not necessarily difficult to accept. I find some of the side effects are actually not so tough going for a woman.
And also, I find that very often young women believe that if they have been diagnosed with breast cancer, that will immediately mean a mastectomy. But it's not necessarily the case, right? Again, it depends case by case.
Yeah, we know that doing a lumpectomy and radiation after lumpectomy, if a lumpectomy is feasible, the outcomes are very similar to the outcomes, or the survival outcomes are the same as the ladies who have had a mastectomy. Sometimes I have a woman tell me, oh, if I have a mastectomy, it means breast cancer can never come back. And that's not necessarily true. Having a mastectomy doesn't mean or doesn't negate the need for further treatment, such as chemotherapy or targeted therapy or hormonal therapy, because there is still a risk of breast cancer recurring, not just in the breast itself, but perhaps the other breast and the rest of your body as well. That's why also in certain situations, we have now shifted to giving chemotherapy before a lady has surgery in some situations, because by giving chemotherapy, we might be able to reduce the size of the tumor to enable a surgeon to do a lumpectomy and preserve the breast.
And so I think that's another important point that you raised there, is that, of course, if you have been diagnosed at a younger age, your risk of a secondary cancer is also higher.
Mm-hmm.
It's only the fact because you have many, many more years to live, right?
Absolutely.
I mean, just this logic, but that's also the reason why by just removing the breast might not do the whole job, that you need to do additional treatment to prevent secondary cancers.
Yeah, I mean, we know that breast cancer is actually what we call a systemic disease. That means it's a disease that affects the whole body. And if you think about surgery, it's surgery that it's a targeted therapy, so to speak. It just targets it's local therapy. It targets that local area, but the rest of your body still needs that treatment, because there potentially may be little breast cancer cells that are lurking around in the bloodstream, elsewhere, and these needs to be targeted by our cancer treatments.
I have another interesting comment here about a lady that says that she has just been diagnosed with cancer and she went to see 2 different oncologists and the treatment plan is different. So how do they manage that? And that's actually something that is also quite common that I see very often, that it's not all black and white. And it's not always very clear, okay, that's the only solution, that's the only treatment. But there are indeed often a few options.
Yeah. Okay, so in this situation, it's good and it's bad, right? Having a lot of options is good in the sense that you know that there are options available, right? It's bad because sometimes it can be quite confusing. And I sometimes do see this in my practice where I have a woman who might have seen 3 or 4 different doctors and everybody gives a different plan. I think that sometimes the plans are all variations of the same. And so how I usually advise my patients on how they decide is pick the doctor you trust, pick the person that you feel the most comfortable with, and go with that plan and don't look back. Actually, a lot of our cancer treatments are, I would say, highly protocolized. There's some very good consensus guidelines that guides oncologists on how to treat breast cancer and certain types of breast cancer. As I said, sometimes there's variation of the same. Go with the person you feel you trust the most. And then the most important thing is get started on treatment. Don't delay the start of treatment because you're trying to seek many opinions and then you get to the state where you get very confused. Go with the person you trust.
I think that's an important point. So as I always try to say that they should have the time, to get all the information that they need. They also need to act quite quickly when they are young, because we know that it's growing faster, and the faster that you will intervene, the better the chances of survival.
Absolutely. Yeah.
I have another question. How does COVID impact now, young women and who are facing a diagnosis of breast cancer? Does it work differently in the hospital? Is the triage different? Is the way that you treat them differently?
Yeah. So when we were at a height of COVID, maybe a year or so ago, when we didn't really know a lot about COVID, we were very cautious, obviously, and we follow very closely the evidence that was emerging from other countries that, had much higher rates. And at that stage, we were being very considerate and mindful about limiting our patients' visits to see us. So the way we choose certain regimes, the way we choose certain treatments may be done so to try and mitigate the risk, um, uh, or try to reduce the visits to the cancer centers, for example. And there may be certain medications that may increase the risk of lung inflammation, for example, which may hide the symptoms that are associated with COVID. Fast forward 1 year later, now we know more about COVID, and now that there is a huge drive to vaccinate our general population, I find that there hasn't actually been much limitation in our treatment. We carry on business as usual. There is a little bit more, how do you say, there's a little bit more of logistics that we have to consider, such as you mentioned, the triage to come to the cancer center. We screen patients for fevers, we screen them for contact history, so on and so forth. And sometimes there can be an impact in the sense that if someone were on a quarantine order or had a contact with somebody who is positive, we may not permit them entry into the cancer center, and it may delay their treatment, by a few days or by a week, so on and so forth. One thing that is good is that our government or our Ministry of Health has now permitted our cancer patients to be vaccinated against COVID. And I think that's a very important message to send across as well, because we know that cancer patients, if they were to unfortunately get COVID, the risk of severe COVID is much higher than a normal or a healthy person who does not have cancer. So I think it's important to consider vaccinating, because vaccinating can at least reduce the severity or the chances of getting severe COVID. And it just means that as an oncologist, I've had to schedule my patients' vaccination according to their treatment plan and make sure it doesn't interfere, such as during the time when their blood counts or their immunity might be the lowest with chemotherapy, for example.
Okay, wonderful. Dr. Tiratan, I want to really thank you for taking your time. I know you have another meeting, so I will let you go. Thank you so much. I probably will have some more questions that I will pass on to you later.
Absolutely.
So thank you so much, Dr. Tiratan, and I will let you go from this meeting, and I just say goodbye on my own.
Thank you.
Bye.
Bye-bye.
So yes, so I just wanted to just talk a little bit more about the incidence of COVID and breast cancer. And I definitely have noticed that it does have a deep impact more on the psychological part for women, and women tend to feel more isolated because you are just more limited, you know, in the way you can move, in the way you can see your loved ones and your friends. So it makes life a little bit harder, definitely, for cancer patients now in COVID time. And I would say it's a reason, you know, to really try to find your support team around you and to find additional support, because it is indeed more isolated. And I believe that particularly young women need to talk about it. And I have found that it is very therapeutical to talk to other women who have gone to a similar situation. Not that it's always exactly the same situation, but it's important to share with, you know, women that have had a similar situation in the same age group. So don't hesitate also, you know, to contact us if you want any further information. You can go on our website, thecancercoach.org, and read a lot more about my personal history with breast cancer, but also you can ask for a free consultation with me that I would be happy to give you, particularly now also for young women with breast cancer. So thank you very much for participating to this live event, and don't hesitate to send us more questions. We will answer them, even for the ones who are looking in replay. See you very soon. Thank you. Bye.